When you enroll in a Medicare Advantage plan, there are several types of costs that you may incur, such as premiums, deductibles, copays, and coinsurance. Medicare Advantage plans also have a maximum out-of-pocket limit, which is the most you can expect to pay for covered A and B services in any given year. But what exactly counts toward that limit and what doesn't? Your monthly premiums do not count toward this limit, and neither does your Part D drug spending. However, the deductible and any copays or coinsurance for covered Part A and B services that you come out of pocket for will count toward the plan's maximum out-of-pocket limit. Part A and B services are your inpatient or outpatient services. In case you are unfamiliar with some of these terms, your deductible is what you are required to pay before your plan starts covering certain procedures and services. Your copays and coinsurance are your share of the costs toward covered services. Copays are usually a flat dollar amount. For example, your plan may require you to pay a copay when you visit a doctor. Coinsurance is usually a percentage of the cost of a service. For example, your plan may require you to pay 10% or 20% coinsurance for a specific service that is outlined in the plan's summary of benefits. Once you've met the maximum out-of-pocket limit for your plan, that's it. You will no longer have any costs for covered Part A and B services that year, not even a copay or coinsurance. But be aware that outpatient drugs are handled differently. Any expenses you incur for your Part D outpatient prescription medications, including the drug deductible if there is one, will not count toward the plan's maximum out-of-pocket expenses for the year. Drug plans work a little differently, so I will put some links to a few videos in the comments below. Lastly, any expenses for services that are not covered by your Medicare Advantage plan will, of course, not count toward the plan's maximum out-of-pocket limit. These will be separate expenses that you will pay for on your own. Make sure to review your plan documents to understand what is covered and what is not. The best way for you to manage your out-of-pocket costs is by staying informed about your coverage and reviewing your plan materials annually. Your plan's summary of benefits and/or the evidence of coverage booklet will help to outline all the different costs that you can expect to pay. Each quarter, your plan should also send you an EOB, an explanation of benefits, for any recent claims. This will help you keep track of your costs as you go on throughout the year. When you're choosing a Medicare Advantage plan, it is so important to review all the costs of the plan, including the maximum out-of-pocket limit, to ensure that you're able to pay in case something catastrophic were to happen to you. Do you happen to know your plan's out-of-pocket maximum, and do you have the funds on hand to pay that amount out of pocket next year if you have any unexpected healthcare expenses? If not, a Medigap plan could be a better fit for you. Let us know in the comments what you like or dislike about Medicare Advantage plan costs.